You've probably heard that modern medicine makes surgery painless. But what happens when even the strongest painkillers aren't enough? Some surgeries are so painful that even with modern medicine, recovery can be brutal. Today, we're diving into the world of the most painful surgeries ever performed on the human body. Stay with me until the end, because the number one surgery on this list is something most people have never even heard of, and it tops the pain scale for a reason. Let's start at number 10. Cardiac surgery. Coronary artery bypass grafting is a procedure in which surgeons take a healthy blood vessel from another part of the body and use it to bypass blocked arteries and restore the blood flow to the heart. They open the chest by cutting through the breastbone to access the heart, which involves significant trauma to the chest wall. The recovery is long, and patients often feel deep soreness with every breath and movement. Pain scale? Around 71 out of 100. At number 9, craniectomy. In this surgery, part of the skull is removed to relieve brain pressure due to trauma or swelling. It is crucial to prevent further brain damage. It might sound strange that brain surgery is painful, but here's the thing. While the brain itself can't feel pain, the scalp, the bone, and the healing afterward are excruciating. Patients often describe pounding headaches and long recovery discomfort. Pain scale, 73 out of 100. Coming in at number 8. Total joint replacement such as hip or knee. They are done to relieve pain and restore mobility in those with severe joint damage. Imagine the hinge of a door being swapped out for a new one. That's basically what happens in knee or hip replacements. The cutting of bone, trauma to the surrounding tissue, the insertion of metal and plastic parts, and intense physical therapy afterward make this one rough. Many patients say physical therapy is the most painful part, but it's also what gives them their mobility back. Pain scale, 75 out of 100. Imagine going through this operation and still feeling pain in a body part that's no longer there. Sounds impossible, right? Let's talk about it. Number 7. Amputation. It is surgical removal of the limb due to trauma, infection, or disease. Losing a limb is not only emotionally devastating, but physically torturous. The surgical wound is formed by cutting through muscles, bones, and nerves, but what makes this extremely painful is phantom limb. When the brain still feels pain in a part of the body that's no longer there. Imagine feeling your foot burn when it's not even attached anymore. Pain scale, 78 out of 100. Now at number 6. Proctocolectomy. This surgery removes the colon and rectum, often for conditions like ulcerative colitis or cancer. The pain is significant due to extensive nature surgery. Recovery involves relearning how your body functions, adjusting to new ways of digestion, and managing constant discomfort. Pain scale, 80 out of 100. Number 5. Thoracotomy. This one is notorious among doctors as one of the most painful incisions in all of medicine. Surgeons cut between the ribs to access the lungs, heart, or esophagus. This surgery is done for lung cancer, pneumothorax, or trauma. The pain is due to chest wall trauma and manipulation of lung tissue. The healing ribs can feel like knives with every breath. Even simple acts like sneezing or laughing can be unbearable. Pain scale, 86 out of 100. At number 4. Pancreatectomy. Removing all or part of the pancreas to treat pancreatic cancer or pancreatitis. It is invasive and complex surgery that forces the body into lifelong changes since the pancreas controls blood sugar and digestion. Patients report intense abdominal pain, weakness, and long-lasting sensitivity. Pain scale, 88 out of 100. Now for number 3. Pelvic exenteration. This is one of the most extreme surgeries for advanced pelvic cancer, where multiple organs in the pelvic area are removed, sometimes including the bladder, rectum, and reproductive organs. The pain is due to extensive tissue removal and potential nerve damage. The sheer scope of this operation makes the recovery grueling. It's like healing from several major surgeries all at once. Pain scale, 90 out of 100. We're getting close to the top. Number 2 is spinal fusion. This surgery fuses 2 or more vertebrae together to stabilize the spine and reduce pain caused by instability. The back muscles are cut open, bones are fused, and screws or rods are placed to hold everything in place. The recovery is long, stiff, and unforgiving, with pain levels often stretching well beyond what painkillers can fully cover. Pain scale, 91 out of 100. Finally, number 1. Spinal reconstruction. This is the Mount Everest of painful surgeries. It's not just fusing bones, it can involve rebuilding entire sections of the spine, correcting severe deformities, and realigning the backbone. Patients endure multiple incisions, muscle trauma, and manipulation of delicate nerves. Sometimes surgeries last over 12 hours. The recovery is one of the longest and toughest journeys a human body can face. Pain scale? A staggering 95 out of 100. So why does this matter? Because pain in surgery isn't just about suffering, it's about resilience. Every person who goes through these procedures is fighting for a chance at better health, longer life, or simply freedom from disease. If you've made it this far, you probably realize how remarkable the human body really is. It can be cut, stitched, reconstructed, and still find a way to heal. Which of these surgeries shocked you the most? Drop your thoughts in the comments. I'd love to hear your reaction. And if you found this video eye-opening, make sure to like, subscribe, and share it with someone who's fascinated by medical science.